Health officials continue to warn people about the potential to catch COVID after they are vaccinated. The CDC says vaccines lessen the chance of death and serious illness. So what happens if you catch COVID before you're completely vaccinated? One woman is dealing with that exact problem. Should she hold off on her next shot? Is she immune for 90 days? Reporter Raven Richards spoke to her and a health expert to answer those questions.
Everybody stay vigilant about it and keep wearing your mask. And just because you have the vaccine doesn't mean that you can't get COVID somewhere.
Walnut Hills resident Emily Garrier says she's tried her best to avoid COVID throughout the pandemic, but on Easter Sunday,
I lost my taste and smell
after getting her first vaccination on March 30th. So she called her doctor.
She said that since I had the vaccine, it was less likely that I had COVID. But because I was still building up the antibodies, I might as well go get tested.
She took a test. The results came back positive. Garrier has been recovering since then, but her second vaccine is still scheduled for next week.
I heard a lot of stuff from a lot of different people that I had to wait quite a bit, or that I had to, it had to be 90 days after or something.
If you have or recently had COVID, should you still get vaccinated right now?
She can go ahead and she should go ahead and get her second shot.
Susie Francis with St. Elizabeth in Covington says the vaccination process doesn't have to be restarted.
You start building antibodies after the first vaccine. However, as best as Pfizer can estimate, after one shot, you have about 87% of the antibodies, likely only about 57% or so protected.
After being fully vaccinated, there's still a chance you could get COVID-19. For now, continue to follow health officials' recommendations. In Cincinnati, Raven Richard, WCPO 9 News.